impact of COVID-19 on artisanal and small-scale miners and their families in the municipality of Beta Santander, we work on the following main activities, taking into account that the municipality went from being amazed by what has happened with the COVID to not believing in COVID-19. We proposed a characterization of 300 families to evaluate their state of vulnerability and risk of infection by the pathogen. Work was done to adapt the biosecurity protocols of the Ministry of Health and Ministry of Mines for mining work and self-care among the 300 families in the municipalities. The first thing that became evident at the beginning of the pandemic was the increase in domestic violence and stress for the women of the municipality as they had to deal with the aggressive behavior of their husbands, having to learn to manage technology to guide their children in their studies and decrease in time to seek other income, such as going to the river to look for gold. Therefore, the creation and consolidation of Women Who Are Worth Gold program was carried out to highlight their role and strengthen their skills and give them the security to cope with this new normality of COVID-19. The other main activity was to strengthen a line of attention and follow for the families with members who showed symptoms in order to make an encirclement and stop the spread of the virus. Next, please. These are some examples of the brochures that we gave to workers or in-house with specialized professionals. And next, please. These are examples of activities carried out with children, with women, doing rapid tests for epidemiological screening in the company of health and mining companies. These face-to-face activities were always carried out following biosafety protocols and social distancing. Next, please. According to the above activities, the achievements were as follows. In the characterization of 300 families to assess the state of vulnerability and risk to the infection of the pathogen, we managed to produce a report not only for 300 families, but for 311 families, since 11 families of the community of Betas asked us for our support. This report gives us a result of baseline where we know what morbidities are presented in the workers, how is their mental health, how is their family form, and how they are currently assuming the consequences of the impact of COVID-19. For the next one, the adoption of biosafety protocols for mining activities through social outreach processes. It was possible to change their thinking that COVID didn't exist and implement the resolutions and decrees of the ministry regarding mining activities and self-care, not only at work, but also at home in everyday life that COVID-19 entails, such as the use of masks, hand washing, and use of alcohol. Colombia is going through the third peak of the pandemic, and in the capital of the Department of Santander, the hospitals today have exceeded the 100% of the capacity of the ICUs, and municipalities around the municipality of Betas have a high level of infection. Thanks to all the strategies we were able to implement, Betas today only has one positive case. For the creation and consolidation of the Women Who Are Worth program, the empowerment of women was achieved through training such as financial education, sustainable development, soft skills, gender equity, leadership, biosecurity protocols, sanitary emergency, and digital marketing, opening the possibilities that through the Secretary of Women of the Department of Santander. And as a strategy of economic reactivation, they opened and took into account our program of Women Who Are Worth Gold. And lastly, the implementation of a hotline and follow-up of families. We managed to control the level of COVID-19 infection, saving money to small companies by following up very closely all the employees who presented symptoms and had to go to isolation with their families. Next, please. So for our challenges, our main challenge was the lack of credibility of the mine workers and their families about the existence of COVID-19. Since there's information in the country about the pandemic reached our municipality, and it was said that it was a government strategy to control the world economy. So at the beginning, it was very difficult to change this concept to the workers and their families, and accept this new reality and the implications it brought in daily life. This also led us to look for a strategy to change professionals with better experience and who did not belong to the same municipality to break their familiarity with the same community and thus believe that COVID-19 did exist. Another challenge was to implement virtuality in the trainings. We achieved it with the women, but not with the workers. With them, we had to hold face-to-face meetings with a maximum of 50 people and with all the biosecurity measures as ordered by the national government. Next, please. Our strategies to make the project sustainable have been to ally ourselves with the government, Santander government, especially with the Secretary of Women's Affairs. Managing to get 10 individual women in an association peasant women trained to buy our program that worth goal to obtain productive projects that will alleviate the finances of these families. We work with the support of the municipal office to extend this program to families that had not been benefited by this. We worked with the local health centers at the health promoting entity to develop a strategy with the results of the characterization that will lead us to reduce the morbidities and of the workers and their families. A commitment was made with the associated companies to continue following the biosafety protocols to avoid an increase in the number of infections. Next. With the characterization and the instruments used, such as sociodemographic profiling, health conditions, occupational examinations, we were able to conclude that the great impact left by COVID-19 has been the affectation in mental health, increased consumption of alcohol, cigarettes, and in some cases, psychoactive substances. This baseline gives us the input to make a priority approach to these cases. With the Women Who Are Worthwhile program, we were able to observe the capacity of redesign and desire to undertake. We also discovered the fear of generating new income opportunities and failing in this attempt. Therefore, it is essential to strengthen these issues. And finally, we cannot finish without thanking immensely each one of you who have put your grain of sand so that a remote and forgotten mining company is managing to overcome the impacts of this pandemic and to start a new reality. Thank you.
Great. Thank you so much, Yvonne, and your daughter. Thank you so much for that presentation. And I think there's a lot of interesting nuggets there.
Agradezco mucho, voy a estar muy pendiente de, agradezco mucho su atención, voy a estar muy pendiente de todas sus preguntas. Quien expuso fue mi hija, espero todos hayan podido atender. Como dijo, nosotros no hablamos inglés, hablamos español, pero muy orgullosa de que mi hija me haya podido traducir. Gracias.
Great, thank you, Yvonne. We will be taking questions. We'll have the discussion period after the next two presentations. So do send your questions into the chat, and we will. Yvonne will be happy to take those, and we can discuss kind of further when we have that open discussion. But with that, I want to just keep the time, and we're gonna move forward. Our next speaker is Enoch Nimpama Pamya from the Director of Research and Administration for the Action Coalition on Climate Change. They're a Ugandan NGO established in 2009 that specializes in oil and extractive industries, construction, infrastructure initiatives, climate change, agriculture, gender, and human rights areas. Enoch is a senior public policy researcher in the areas of education, environment, peace, and conflict, and brings over 15 years of professional experience in the mining sector in Uganda and East Africa. So Enoch, we're excited to have you and to hear from you today. So I'll hand it over to you.
Thank you very much for the good introduction. Good afternoon here in Uganda. Our project focused on mitigating the health and social impacts of COVID-19 among small-scale artisanal miners in the districts of Busia and Mubende, Busia being in eastern Uganda, Mubende being in central Uganda. In terms of the context and the background, next slide. In Uganda, we have over 150,000 small-scale artisanal miners who directly depend on gold mining, and a large proportion of ASM are women and children. As a result of COVID-19, currently the status of COVID-19 in the country is such that 42,427 are confirmed cases of COVID-19 with 346 deaths. This report is what the Ministry of Health submitted to World Health Organization on May 2021. 96,103 vaccine doses have been administered to Ugandans. As a result of COVID-19, it has had a significant impact on the artisanal miners, or ASM. This is epitomized in terms of food security, domestic violence, early child marriages, malnutrition, and other ailments among the children. Furthermore, it has also increased on the levels of poverty and loss of incomes among the ASM, closure of mines, and of course, we have also witnessed rural-urban migrations, whereby many people are leaving the urban centers to the villages because they were not sure of how long the lockdown would take. Now, as a result of COVID-19 further, the lives of miners and their dependents is at a very high risk, and this is likely to exacerbate issues of starvation and survival. Our project thought to address the project objective, which is improved awareness campaigns for ASM in coping with COVID-19. Next slide, sir. Yeah, the Action Coalition on Climate Change has already been introduced, but it is a national NGO that was founded in 2009, and our vision is a well-managed environment for sustainable livelihoods. Our core programs are extractives and petroleum, environment, climate change and disaster risk reduction, agriculture, gender, and human rights. In terms of the project activities, of course, our activities were geared towards raising awareness on the impact of COVID-19, and the following have been completed. Actually, all of our project activities have been completed. 10 focus group discussions have been held with ASM and 4 strategic meetings with policymakers. We've also conducted four radio talk shows in ASM Communities. 2 national TV talk shows have also been conducted. In addition, we've developed and distributed over 2,000 brochures, which have been translated in the local languages of the project area. Next slide. In terms of the achievements and the impact, we've realized as a result of our intervention, we have a mindset among the ASM who had initially underestimated the reality of COVID-19 to the extent practical that initially they had ignored using standard operating procedures such as social distancing, which has been set by the Ministry of Health, but this mindset has changed. Then we've seen that the district local governments of Mubende and Busia are supportive of our intervention, and they have asked for a memorandum of understanding so that we can reach out to other areas which are not covered under this project. In terms of ASM and policymakers, they are willing to implement the which we have and the skills which we've shared with them. Then we've also realized media attention has increased because now they are interested in covering the plight of ASM in COVID-19, which was not the case before. And of course, they're also willing to use the education and communication materials which we developed to further deepen engagements on COVID-19. Next slide. So in terms of the challenges, we've realized we faced some challenges. As I said, initially, the ASM never believed in the existence of the virus and its related risks. They believed they were too far away from the reach of the virus. That is to say, the virus in Uganda was reported in urban areas. And in terms of the location where ASM are, they are in rural areas. So they thought they were too far from being reached by the virus. We also had an issue of observing social distancing at the beginning. And of course, putting on the masks. Then the project was implemented at a time when there was a national lockdown and heated presidential and local parliamentary campaigns. In addition, this was supplemented with the internet shutdown for social media, and as up to now, Facebook is not allowed to operate. It is closed. So these challenges were overcome by rescheduling some of the meetings and appointments. Liaising with the national and district COVID-19 task forces is clearance because they ended up seeing us as partners. Then, of course, we engaged the district leadership and ASM structures. Then, of course, we had to engage the Media Fraternity Association to ease organizing radio talk shows. Mindful of the fact that, as I said, it was implemented when there were heated presidential and parliamentary elections, and therefore the media focus was on the politics. So with our engagement with the media fraternity, we were able to hold these talk shows. Next slide. Yeah, in terms of sustainability strategies, we are saying the results and the products of this project shall be sustained through building the knowledge capacity of the miners, leaders, local government leaders, and ASM communities. We are also instituting or using the existing structures and mandate of the ASM associations and district local governments to maintain, to be able to reach out to others. We're also trying to ensure a close relationship with the beneficiaries by instituting a strong feedback mechanism and continuous collaboration and communication with selected local governments, miners, leaders, and community representatives who will act as focal point persons must the project come to the end. Next slide. Yeah, key learnings, reflections, and recommendations. We recommend that for better results, there is a need to reach out and deepen sensitization of other ASM not covered in this project. We are also suggesting that there is a need to provide financial support and promote cross vis among the ASM so that they are able to share the experience. Now, we also are suggesting that there is a need to engage other responsible authorities, such as the Ministry of Health, Uganda National Bureau of Standards, National Drug Authority, Ministry of Gender and Local, Ministry of Gender and Local Social Development, Parliament, and the media houses for us to be able to consolidate our achievements. I thank you very much.
Great, thank you so much, Enoch, for that great overview of the project and its impact. And I think some interesting things to come back to there around the relationships you were able to establish with local government and media houses to increase coverage and visibility to the sector through this project. It'll be interesting. We can maybe touch on that in our discussion. To keep us kind of moving forward with time here, I want to transition to our last speaker for today, Chris Anthony Ogbonna, who is the Executive Director of the Safer World Foundation, which is a nonprofit organization based in Nigeria that works to reduce violent conflict, minimize the impact of violence on individuals and communities at large, and also build safer communities. Chris is a project management and monitoring and evaluation professional with over 8 years of experience in various humanitarian and development contexts in Nigeria. And so, Chris, I'll turn it over to you now for our final presentation. And just a reminder, if you do have questions, feel free to submit them in the chat before our discussion period that'll follow this presentation. So Chris, over to you.
All right, thank you very much, Nate, for that quick introduction and overview. So basically, I'm making our presentation from the Nigerian side with regards to the intervention from Safer World Foundation, primarily targeted at promoting a resilience to the impact of COVID-19 in artisanal mining communities in Niger State and Osun State of Nigeria. Niger State is in the northwest, north central part of Nigeria, then Osun, of course, is in the southwestern part of Nigeria. So looking at our context, basically, as at 13th of May this month, Nigeria, of course, has recorded over 165,000 confirmed cases of COVID, with also over 262,666 deaths. So for us, our major challenges are associated with COVID. Of course, there are still concerns and lag in terms of capacity for testing. Then, of course, we have also issues around ignorance about the true scale of the pandemic. Then, of course, issues of social and economic challenges that are affecting people, especially also mining communities. This is actually occasioned by the lockdown that have been imposed in several places just to mitigate the spread of COVID. So coming closer to the issues of ASM communities, of course, you have closing of business activities and restricting movements and gathering of people. Of course, you know the situation and context around mining communities. So a lot of mines are closed down and restriction of movements and gathering just to ensure social distancing and all of that. And of course, we have a case in Nigeria and in Osun State. Of course, those measures put in place have affected income generation, have affected livelihood support, and have also affected issues of social cohesion, because of course, again, the mining environment or the mining sites are also avenues for socialization for a lot of people, to beside the economic attraction to the mines. Then of course, women have also been impacted by the pandemic. Issues of gender-based violence, issues of economic burden on women as a result of closing down of economic activities. Next slide, please. So of course, we talked about the work Safer World has been doing with regards to working with mining communities to support awareness creation, business development initiative to promote sustainable livelihood, quality of hygiene practices, and empowerment of women who are mostly disadvantaged in all of these activities. And the work also involved building sustainable mining communities through innovation and technology, also strengthen the value chain and delivery through empowerment programs. This particular project is actually implemented also in partnership with Ziva Community Initiative. And so key activities implemented, we actually get towards increasing the knowledge and capacity of men, women, and youths in artisanal mining communities of COVID-19 health and safety protocols during mining activities, while also working to enhance their socioeconomic capacity through livelihood and economic support. So summarily, we looked at two areas, the health implication, but of course also the economic downturn associated with COVID. So our key activities, we have, of course, awareness raising activities through advocacy and sensitization workshops, trainings. We also had distribution of free face masks and hand sanitizers to mining groups to curb the spread of the virus. Of course, education on the use of local resources, such as ashes and all that in washing of hands, especially in places where people cannot afford hand sanitizers, which they see as luxury sometimes. Of course, we also had cases of design and installation of signposts with COVID-19 health and safety tips, which are also translated in local languages. And so we had those installed in different mine sites, talking about the need for social distancing, talking about the need for use of face masks and hand washing. Of course, creating also a linkage between ASM and governments to provide government support. We also realized that there have been a lot of government support, palliative, economic stimulus for people generally, but there are no direct support to ASM communities. And so we had to do a linkage between the relevant ministries and the ASM communities. Please, next slide. So basically, key achievements that we would have recorded over the period of implementation. Of course, all project activities have been implemented, fully executed, and so we're just awaiting final reporting. And so what we've been able to achieve, of course, there have been a platform. We created a sustainable platform for exchange between government and ASM communities, basically to address emerging health and safety concerns, and for channeling of official government information, responses, and support to ASM communities. And of course, we got the confirmation and affirmation from government MDAs affirming their support to ASM communities in curbing the spread of COVID-19. Of course, the key for us, again, is that there are also the myths and mistrust around issues of COVID, the spread, the myth around it. So we'll have ASM communities where we worked in, and the selected sites have had increased knowledge about COVID and how it spread, and of course dispels certain disbelief that it's an elitist virus meant for the bourgeois or those in urban centers. So of course we have attention of the various state governments. We're also drawn to the plight of ASM communities as having impacted by the COVID. Of course, we created, like for the platform we talked about, so it was an opportunity for government, ministries, departments, and agencies, high government officials to actually understand the magnitude of the impact, hearing firsthand from members of the ASM communities on how it has impacted them. Next slide, please. So for us, key challenges that we have faced in the implementation of this project was still the issues around the misconception, particularly in ASM communities, about the existence of COVID. Of course, people feel that it is just a government propaganda, it's just created here. And so there was initial apathy on why do we participate in a program or a project that has to just talk about COVID and its impact and all. But a way we were able to mitigate the challenge was, of course, dedicating ample time to active and efficient advocacy and sensitization visits to different ASM communities, to different government stakeholders, with emphasis particularly on the impact of COVID on their economy, on their health, on their livelihood. Of course, certain instances also of the increased number of deaths in most of those communities. Another key challenge we also experienced in this project is the increased cases of insecurity. Of course, within those mining sites, and those of us, if you have been following also the issues and the news from Nigeria, most of these conflicts that we're having, banditry, kidnapping, and all of that, are also centered around ASM communities. And so it was really a huge challenge, which affected project implementation in terms of time. We had to shift a lot of activities and also had to bring some activities to the city center, which of course increased logistic cost for the project that we have. Of course, these challenges had its impact, but we were able to mitigate them. Next slide, please. So what are the key sustainability strategies that we have put in place? One key strategy is the platform and the linkage that we've been able to establish between government MDAs and ASM associations in addressing COVID-19 related impact on ASM communities. And so having those bilateral engagement, those discussions in workshops, in stakeholders conferences, in the advocacy meetings that we've had was really key in creating that linkage and that support, because there have been little around discussion around COVID-19 between government MDAs and ASM on those issues. Then of course, second was our design and installation of over 40 signposts with COVID-19 safety and health tips, also translated in local languages. So we visited over, in the project, over 20 mine sites, and in each of those locations we had 2 of those signposts installed in local languages that on a first glance you need to know about social distance, you need to know about regular hand wash, you need to know about use of face masks. You also need to know about the symptoms, how it spread, and what you need to do to take care of yourself if you feel all those symptoms, just to dispel all of the myth around this. Then of course, lastly, we had to do distribution of hand flyers that were designed also in local languages at different offices during ASM activities, just to create the regular awareness that we have. Next slide, please. So for us, key learnings we'll be having here. Sorry, we need to look at, I think we're looking at the sustainability. So, okay, so now key learnings. Of course, there are still issues and doubts around COVID-19, still very evident. So a lot still needs to be done, especially around other ASM sites and communities not visited, and also members of the value chain associated with the ASM community and the industry generally. Of course, learnings for us, reflection will be, there's need also for exchange visits among ASM associations to share their lessons, to share best practices from what they have been doing and what they have in terms of their participation in the different projects. Key learning for us, which we also recommend, is attached to this, looking at also the impact of COVID, is the economic component. And so we also recommend that there could be economic stimulus to cushion the effect of most of the government measures like lockdown, like restriction of movement, to help to curb the spread, and also looking at how it has also impacted women. So this economic stimulus will also be spread also to include women. Then we're also looking at another key recommendation will be to scale up the project to other ASM sites and associations not included in this current project, because yes, attesting to the impact of the project, there's need to scale up and also include other ASM locations and sites on issues and the impact of COVID. Then of course, linkage of ASM communities with primary healthcare centers in project locations. Of course, there are primary healthcare centers around, and so what we would recommend for us in the next phase, which was part of the feedback we got, is to link ASM communities to their primary healthcare centers, because they are also primarily responsible for COVID intervention, sensitization, vaccination, and others across the country. Thank you very much.
Excellent. Thank you. Thank you so much, Chris. And thank you to all our presenters, to Enoch and Yvonne as well for your presentations. I want to just transition now to kind of an open discussion, how we typically kind of have this space in the working group to discuss and ask questions from our presenters. And if there's other kind of experiences folks have in the audience that they want to share as well, feel free to type that in the chat or unmute yourself as well. Maybe to kick off our discussion today, one of the things that stood out to me, I think, and across each of these three kind of contexts and examples, was this common experience of misconceptions or misperceptions about COVID-19, about doubting its existence or the extent of how much of it is a threat for rural communities. And I think that certainly is something that we see here in the US as well, different kind of misinformation and kind of combating misinformation being one of the key challenges in the pandemic. And maybe a question for each of you, just thinking about this is kind of bringing information and sensitization. Is this something that you see increasing as a need in this age of increasing access to information? Is that kind of a growth area for your organizations to continue to have impact? And how maybe has the experience of this response activity impacted your thinking around those types of sensitization and kind of combating misinformation in these contexts? So either of our panelists want to jump in for that first question.
Hello, this is Enoch once again from Uganda. Regarding your question, I think it is still imperative that we carry out sensitization. This stems from the fact that by the nature of the artisanal small-scale miners, first of all, some of them don't have even the communication gadgets. And for the part of my country, they are remotely located. They are far away from urban centers. And actually, like for the part, for what we have experienced, even most of the government interventions don't target these artisanal miners. Some, like for my country, some of them are considered illegal. So how do you go to the community which is considered illegal? We have been pushing for formalization. The point here I'm making is, it is still important that we reach out to these people. They don't have phones. Some are, because in terms of the level of education, some of them are semi-illiterate, and the lifestyle that they lead is the worst. So we still need to move an extra mile.
All right, thank you. I think I would want to ride on Enoch's comment. For us too, is while it's still a similar situation, we did a pre-assessment of those ASM communities before proper implementation. And over 90% of the respondents from our assessment said they heard about COVID-19 from government media or information. However, there is still also mistrust on the government. And so really did not rely on information coming from the government. Yes, even though they have heard about it, but they do not believe or trust information from the government. And so I think that people like us, CSOs and NGOs or organizations working around with ASM communities can actually drive this process of sensitization. Because again, the ASM communities, with their mindsets, the nature of life they live, just as Enoch said, they will have more trust on CSOs and NGOs that relate with them, that can also relate with their issues and concerns. So there's still need to drive this. More is done, information is being disseminated by government, but because of the lack of trust on government, they do not believe this information. So if we drive this through the kind of work we do, we can make more impact. Thank you.
Qué pena contigo, tú me puedes repetir bien la pregunta, más o menos la entendí, pero no.
Great, Yvonne, I think the question was kind of around misinformation and the idea of kind of combating misinformation or these sensitization activities that your team performed. Is there anything that kind of you've learned, you know, as you think about the importance of providing kind of accurate information in these types of situations or other kind of contextual challenges that are faced by ASM communities?
Para nosotros al principio fue muy difícil porque por televisión y por radio se escuchaban muchas versiones. Los mineros pensaban que lo del COVID era un invento de una potencia mundial.
Consuelo, la traducción de Stephanie no se escucha.
No escuchan, qué pena.
La traducción de Stephanie no.
Pensaba que el problema del COVID era inventado por una potencia mundial.
I think we're
Y
still
que allá nos teníamos que era alejar de todo y no ponerle cuidado a nada.
Yvonne,
Empezamos a hacer reuniones con cada trabajador.
Consuelo, la traducción de Stephanie no se escucha. No se ha escuchado nada en inglés.
Great. I'm sorry, Yvonne. Yeah, we're not able to hear the translation. If Stephanie could be closer to the microphone, maybe.
Is it better?
No escuchan la traducción, qué pena.
Nada,
Sí.
absolutamente.
Can you hear me better now?
Yes, we can hear you.
Okay, so I was saying
Now you-
that in our community, the COVID was, people believed that it was a creation by some corporation or some governmental corporation or something like that, like a conspiracy. So we had to stay away from all that and just don't pay attention to anything. That's why we realized and we thought that was really important. So that they would talk to the
I'm sorry.
about the consequences and what was in reality.
I'm sorry, Stephanie, I think it's still kind of a challenge to hear you.
So it's better now. So we started working with the children so that they could tell their parents, and with the women, they had a really important role.
Y así logramos que
Maybe we can move to another.
Yeah, I think we might need to move just to another question. I'm sorry.
Okay.
I'm sorry, Ivan. Let's maybe field another question and try again with the translation. I'm sorry, it's just difficult to hear. So one of the questions I see Enoch brought up, and I think it's something that really we saw in each of your presentations as well, was the use and the establishing of networks and new relationships with either local governments or media entities or others to really help in the coordinating a response and the sensitization activities that you all put forth. I'm just interested to hear a little bit more about how you think about those kind of new networks or relationships playing a future role potentially in efforts to support the sector. Are they kind of entry points that your organization are looking to build on, and as you talked about, building sustainability into your interventions? So maybe if any of the speakers would want to talk to that piece about kind of new networks and relationships specifically to also with media in terms of amplifying, kind of outreach and visibility for the sector.
Okay, so for me, speaking from the interventions we have, we had identified that there have been concerns around relationships with government and the ASM. Just of course, because of the tag on them, most of them are illegal activity. Most of them, because of the kind of lifestyles they live, they are not always included or brought into certain spaces of discussion. But what we have been able to do is to create that platform. And of course, you could see the excitement and the willingness, the exchange of information. There was, of course, rich exchange of information. The government was able to understand the nature and the context of the situation, the impact around the ASM communities, most of their challenges, and a lot of them also voiced out their mistrust, their disbelief about the government processes and systems of operation, even as it relates to the ASM generally. And so for us, this is a good approach, and most of the government ministries and agencies committed to continue holding such meetings monthly or quarterly with the ASM committee. And for us, this is key. Another area where we would want to amplify would also be the use of media. Of course, if the ASMs have said, for us, over 90% of them said they heard about COVID, its impact from media, but as communicated by government, we can now also, as civil society organizations and NGOs working in those space, still use the same medium, that's the media, radio, TV, to also reach out to them, since there's more trust on our kind of intervention. I think this is key. Over from my
end. Thank you so much, Chris, for the clarification. I think back to the question that was posed, if I can provide a different version. Here in Uganda, we have the central and the local governments. Now, the local governments are the districts. So the districts, that is where the mining activities take place within the jurisdiction of the districts. And the districts are governments themselves anyway, local governments. Say, for example, they are staffed with district health inspectors, district environment officers, district probation officers, and other relevant officers. So now, once you build a relationship with the district, now the district can use its own resources, because the districts have their own budgets from the central government. They can allocate some of the resources to go and reach out to the ASM communities within their jurisdiction. It is also their mandate to take care of the citizens who fall within their districts, including the ASM. That's why we had to galvanize our effort in reaching out to the district local governments. Be reminded that for you to reach out to the ASM communities, you need also to get the clearance from the district. At the district, we have the CAO, that is Chief Administrative Officer, who is the head of the technical wing for the district. But also we have the RDC, Resident District Commissioner, appointed by the President, and his role is in charge of the security of the district. Therefore, Without the involvement of the district, it becomes difficult for you to go directly to the ASM communities. That is one. Number two, as I said, they do registration. They play a registration function to the extent practical that they can draft like bylaws to outlaw or to minimize certain activities which they deem not fit to be taking place in the mining communities. They can also pass ordinances. So this is the function of the district local governments. So that's why we found it important that we liaise with them. Then back to the ASM structures. Different mining communities, different mining sites have different associations with different leaderships. Previously, we had a project which was funded by Open Society Institute for Eastern Africa, and this project we were able to take the ASM leaders and some selected miners to Tanzania to benchmark best practices on how they can extract gold without using mercury, for example. Therefore, we are saying, once you have this district structures and associations together, their leaders, once they buy into your intervention, it becomes easy for them to go and reach out to their members in those associations. I beg to stop.
So thank you, Enoch and Chris, for sharing that and the importance of those relationships. Yvonne, do you want to?
Nosotros, como ASOMINEROS, siempre hemos venido trabajando.
We, as ASOMINEROS, have always been working with
de la mano de la institución, del gobierno.
With the government and the institution.
Tanto local
Locally,
como departamental y nacional.
And national.
Este informe, sobre todo de caracterización,
This characterization report
va a servir para varias entidades.
Will be useful for a lot of entities.
Especialmente a la empresa prestadora de salud.
Especially to the health promoting entity.
Para lograr activar un plan, una estrategia.
To be able to activate a plan and strategy.
Para combatir las enfermedades causadas.
To fight the diseases caused by COVID.
Como es la diabetes.
Just as diabetes.
La alta consumo de cigarrillos.
The increase in cigarette consumption.
Inclusive el alto porcentaje de violencia intrafamiliar.
Even the high level of domestic violence.
Muy tristemente hemos visto que aumentó y que los hogares se destruyeron.
We have sadly seen how it has increased and a lot of families were destroyed by that.
Y las consecuencias que ha traído en los niños.
And the consequences it has had.
Entonces, hemos podido tener muy buena relación con la Secretaría de la Mujer.
So we've been able to have a close relationship with the Secretary of Women of the Department.
Y que por medio de nuestras capacitaciones hacia las mujeres,
and that throughout our trainings to women,
el programa de Mujeres que Valen Oro,
the program Women Worth Gold,
la Secretaría de la Mujer decidió apoyar a 10 mujeres y una asociación.
The Secretariat of Women decided to support and fund 10 women and an association.
Con proyectos productivos.
With productive projects.
La idea es seguir trabajando de la mano con la
So our idea is to keep working with the Secretariat.
La viceministra de Minas ha sido un gran apoyo.
The Vice President of Mining has been also a great support for us.
Y muy seguramente estará muy dispuesta a seguir apoyando el proyecto.
And surely she will be really glad to keep supporting our project.
Great. Muchas gracias, Yvonne. And thank you. I'm looking at the time, seeing we're coming up to the top of the hour here. But really exciting to hear about that potential relationships that were established, or the real relationships that were established through this response activity, and what can kind of come from that. It'll be interesting to see, and we hope to hear from you of how your organizations are carrying those relationships forward, and it's influencing future programming. I know we're at the top of the hour, so just wanted to say thank you again to all three of our presenters and everyone joining us today. Really hope this was an informative time, and we're excited to host this as the first in a series of calls that'll feature a number of these response activities from the EGPS response fund that the World Bank has organized to support COVID-19, communities impacted by COVID-19. And so with that, we'll be scheduling our next call in June to look at more of the partnering aspects and building community resilience in a variety of other contexts in Afghanistan, Nigeria, and India. And so please stay tuned for some announcements about that. We'll be sharing that via email. One other plug for us to put out here from the Delve platform. We released last week the 2020 State of the Artisanal and Small Scale Mining Sector report. This is a report that dives into a lot of the OHS themes that we talked about a little bit here today, but also kind of builds on some of the health impacts as well. And so something that folks, if you're interested, you can check it out. We have the URL here as well, but we're happy to promote that as well. With that, yeah, I'll just say thank you again to our presenters and for everyone for joining us. We'll make sure that the presentations are shared afterwards, so folks have access to those to look at that as well as the recording. Thank you all again, and yeah, with that, hopefully we'll see you at our next call.
Thank you so much. Bye-bye.
Mil gracias, que Dios los bendiga.
Thank you a lot. God bless you.
Great, thank you all. Bye-bye.